Hello, my name is Kenton Pierce, and the case study that I've chosen today to dissect and kind of dive into is about physical therapy. And physical therapy is something that is widely respected in the medical field. It is widely used for a number of different physical ailments. If you haven't been to physical therapy yourself, chances are you know somebody who has. Um, and like I said, it's used for a lot of different reasons, but the specific reason we're talking about today is toe walking in children. Now, toe walking is exactly what it sounds like. It is when it's a developmental issue in a child, and it's when the child lacks the ability to do a standard heel toe motion when he walks or she, and instead strictly walks on their toes. There is a predisposition to this. It is found a lot of times in premature children because around the last 4 weeks of a child's development, honestly, it starts getting cramped in there. There's not a lot of room because the baby's growing, the baby's healthy, and it's getting closer and closer to the due date. So, because of this, the ankle. Now, you might think that with something called toe walking, the foot would be the standard problem. Well, it's actually the ankle. And in these last 4 weeks that a baby is maturing in the womb, because of the lack of space, it promotes the stretching and the bending and the flexing of this ankle, which develops a healthy range of motion in an ankle. So when a child is born prematurely, especially over 4 weeks premature, they don't get exposed to that pressure that is put on their ankles, and they're more commonly found to have this problem. And for years, this problem has been solved with surgery. And this specific case study is trying to find if physical therapy can be used to treat this problem and can yield just as successful results as surgery. This case study is about a specific patient. This patient was an 8-year-old boy who, when first evaluated by doctors, was found to have an extreme rigidity in his ankles and the lack of the standard heel toe gait pattern, which basically means his ankles were stiff, they wouldn't bend, they caused a lot of discomfort, and he strictly walked on his tiptoes. So, after they evaluated him, they enrolled him in a 35-week physical therapy treatment. And after this 35 weeks, they reevaluated him again, and they found that he had a 10-degree improvement in the range of motion in his right foot and a 13-degree improvement in the range of motion on his left foot. And on top of this, he had also developed a 100% efficiency rate in the use of the standard heel toe walking motion and had now rid himself of the habit of walking on his toes. And even though the range of motion in his feet and his ankles were still a little bit behind par and weren't quite up to the standard that the rest of the, standard children his age are used to, he had shown a great improvement, and he had also avoided any surgery that could have possibly been required. So to conclude this speech, there's a reason I chose this one. Excuse me. The reason I chose this one is because I actually lived this. I was born 12 weeks premature, and around 3 years old, I was diagnosed with toe walking. And we went and saw a pediatrician in Cincinnati, and this pediatrician, one of the earliest memories I have is this pediatrician staring at my mom and telling her that I needed surgery. And thank goodness for my mother, she didn't agree to that, and instead she tried to find an alternative method, and so she put me in physical therapy. From the age of 4 to about 10, I was in physical therapy every single week. And because of that physical therapy, I was able to have a successful high school basketball career. If you look at me now, you would never know that I suffered from toe walking as a child. I walk completely fine. I run completely fine. I have a standard heel toe motion 100% of the time. And it's because of physical therapy. And there is still a need for a study where they compare the results of a surgically repaired toe walking problem versus a more conservatively repaired toe walking problem through physical therapy, and comparing those results and really seeing if one or the other is better. But with that being said, there is definitive proof in this case study, along with my personal experience, and I'm sure many others, that physical therapy works. And in the end, the goal in this is to avoid any unnecessary surgery on a child. And this case study, and hopefully many more after this, are a major step in the right direction. Thank you very much.